Hello, everyone. Welcome to a webinar outlining a new initiative that I'm so excited to share with each of you today. Today, we'll be discussing CalAIM Links, which is technical assistance and resources for community supports providers. My name is Alexis Taylor. I'll be your host for this webinar. I'm a senior program manager here at HealthBegins. And at HealthBegins, we're a national mission-driven consulting and training firm, and it's our goal to help healthcare and community providers improve the social and structural drivers of health equity for both patients and communities. So for everyone that's joining us, there is going to be a downloadable copy of this slide deck that I'm using today. It'll be available at healthbegins.org/CalAIM. So that way you can go ahead and use that deck to follow along with the materials that I'll be covering today. And in addition to having that link available for you on our website, there's also going to be a table of contents. So that way, after you download this deck, you can just go ahead and click on any one of those items, and it'll take you directly to which area you would like, to have additional information or coverage pertaining to that specific topic. All right, and so I would like to extend an incredibly special thank you to our project partners. CalAIM Links is a collaboration of Transform Health, Aurrera Health Group, and HealthBegins, and we're being generously funded by the California Healthcare Foundation. And if you would like to learn anything additional about these specific companies, you can just click on the links provided in the presentation, and it'll take you directly to their company sites. So we have 5 specific objectives of this presentation. And so by the end of this session, you'll be able to understand the project background and goals of CalAIM Links. What is CalAIM Links? Who are we? What are we trying to accomplish? That is one of the things that we definitely want to make sure that you walk away with a very clear understanding of, by the time you finish this webinar. Next, we would like you to be able to describe the project tracks that we're going to have. We'll have 2 tracks as part of this project, and how your organization can fit into, our 2022 program offerings. Next, we'll ensure that you can differentiate between the curriculum topics covered in the statewide sessions as compared to the county-specific sessions. As a part of this project, we are going to be offering both, and we'll explain exactly what that means. By the time you finish this session, you'll also be able to list the core capabilities that CBOs will need to partner with Medicare managed care plans, or MCPs. And lastly, you'll be able to identify opportunities to build CBO capacity to partner with MCPs in the context of CalAIM. And just to backtrack, I meant to say Medicaid managed care plans. Want to make sure I get that right. All right, and so with those specific objectives in mind, we do have some assumptions about who is viewing this presentation and who this information is catered towards, who is the audience that we expect to review this material. So number one, your organization is a California-based nonprofit provider or a community-based organization, a managed care plan, or a California-based CalAIM landscape stakeholder. So in some way, shape, or form, you are touching the CalAIM landscape. Second, if you're a community-based organization, we expect you to at least have a high-level understanding of what CalAIM is. And if for any reason that you don't, we do have on that same website link that I provided earlier some resources that will provide additional information and context for you pertaining to CalAIM, so that way you can have a better understanding of what DHCS's goals are. Number 3, we also would expect that these audience participants have a high level understanding of what community supports are. And then lastly, if you're another type of CalAIM landscape stakeholder, your organization is interested in learning more about the partnership and relationship building opportunities that we're going to offer through CalAIM Links. And with that, I would love to provide a little bit more information about the background of our project. And so at a high level, most of us understand that CalAIM is attempting to transform Medi-Cal by providing a more equitable and coordinated service approach in services. And one of CalAIM goals is to improve quality outcomes and reduce health disparities among Medi-Cal beneficiaries. That specific initiative provides an opportunity for CBOs and MCPs to work together to realize that promise. But we understand that smaller CBOs, particularly those that are BIPIC-led or BIPIC-serving, and those that employ a community-based workforce, they're going to encounter challenges, when they're seeking to get those contracts with plans. And this is because they don't have those existing relationships, and the landscape infrastructure wasn't exactly previously set up to advance that partnership development. But we understand that a strong equity-oriented partnership between CBOs and the plans is critical to the success of CalAIM and to transforming, this system and improving those quality outcomes. So in 2021, CHCF, which is the California Healthcare Foundation, funded our work to design an intervention to advance those relationships. And I have information on how that went. All right, so as a part of our 2021 program, we were able to host 9 technical assistance sessions, and those sessions focused on improving CBO contracting readiness and advancing their CBO relationships with MPCs. Like we said, CalAIM presents this amazing opportunity for us to improve outcomes, but that collaborative approach, between the CBOs and between the MCPs is critical to that success. 2 of the sessions that we hosted were statewide sessions, and the remaining sessions were hosted in 4 specific counties. Those counties were San Joaquin, Stanislaus, Shasta, and Sonoma. And within those counties, we work with 3 health plans to design the content and answer questions that CBOs had about contracting requirements. Once again, we're trying to move the needle on their contracting readiness to ensure that they can partner with those plans to provide community supports services. And so in amalgamation of all of those activities, we were able to reach 769 participants that ended up joining those sessions. And the response that we received was incredibly positive, which was the motivating factor that we need to continue this work, because we received feedback from those plans and from the CBOs. There were other areas that needed additional technical assistance. And so now I'll dive into what, our 2022 program goals are going to be, and exactly how your organization could potentially tie into that work. And so taking the lessons that we learned from those previous sessions and with continued support from CHCF, we've designed a continuation of our program offerings for 2022. And so the goals of our project, which is what you're primarily here to understand and learn more about, we are seeking to strengthen the statewide capacity of community-based organizations that seek to offer community supports services. Number 2, we want to build impactful relationships, between the CBOs and the MCPs by facilitating these learning sessions in which you can have very significant and impactful takeaways regarding the contracting process. As a part of that, we also want to increase your networking and community building capacity, with those managed care plans. Lastly, we want to recruit CBOs that are led and served by individuals from historically marginalized communities. And we want to focus on identifying and addressing the needs and identifying the barriers that you've experienced as a community-based organization. So with that being said, and with those goals that we have in mind, we want to discuss, the value that exists in being able to render such a program. We want to support CBOs in determining the best path to being able to contract and partner with MCPs. And like I said, we also want to identify any system barriers that you might experience as it pertains to, delivering community supports, for Medi-Cal beneficiaries. And so there are multiple values that, this program is offering, but there are 4 specifically that I want to highlight at a very high level. And so number 1, which is very important, we want to support you in assessing your own organization's strengths and readiness to engage in contracting partnerships. And how are we going to do that? We have designed a CBO readiness assessment to determine which track your organization is best suited for. And I'm going to go into details about those tracks. As I mentioned previously, we're going to have statewide sessions and we're going to have county-specific sessions. And so the CBO readiness assessment would really help your organization gauge which is going to be the best path for you. Next, via the implementation of a network assessment that we're going to receive plan input from, we would be able to support both the MCPs and CBOs in identifying those landscape gaps and opportunities, in the context of community support specifically. Like I said previously, while CalAIM creates this amazing opportunity, we know that there are barriers that exist, and we don't just want to, sit in this cyclic place of not understanding those barriers. We want to make sure that we're collecting data to document them and then to address them. So how can we, within the context of CalAIM community support specifically, specifically move beyond those gaps by, supporting you and having the tools and resources needed to address them. Number three, we want to help your organization determine whether or not it is most feasible for you to directly contract with the plan or to indirectly contract with another contracting entity. Some CBOs don't realize that there are other pathways to being able to secure those contracts, such as through a county agency or an intermediary. And we want to make sure that you not only understand that you have that option, but you also know the pathway to being able to secure, that indirect contract. And then lastly, as noted, one of the most important takeaways, and features of this program is being able to strengthen your relationships with MCPs, as well as other agencies as well. This could include counties, ECM providers, other community support providers, intermediaries, and other TA providers as well, outside of, those project partners that we at HealthBegins are working with to execute this project. The reason why that's so important and why that's so valuable is because this is a long-term initiative. This is not something that is going to take, a couple of technical assistance sessions to be able to have, just 100% confidence in your organization's ability to secure those contracts. But what we are doing is moving you towards that readiness. And we want to make sure that you have the tools, resources, and the relationships to be successful in that process. And so, as I previously mentioned, we are going to have multiple tracks. And so for the statewide approach, we're going to host 3 sessions. Those 3 sessions are going to take place over the next 6 months, and those are going to encompass a foundational curriculum. So you're going to have a very high level understanding of the universal standards that apply to CalAIM specifically. Those aren't going to be plan specific, but if you are not advanced or, already approaching or mid-contracting, this is going to be for your organization. Something that we took away from the last phase of work is that CBOs across the state are at vastly different levels of contracting readiness, with some, already being mid-contract and engaging in negotiations in those contracts with the plans directly already, and with others still figuring out, hey, what is this? What are my options to contracting? What are the requirements? And so we're going to cover those universal standards within the statewide sessions. And of those 3 statewide sessions, the first is taking place, at the end of May. And we'll get into the timeline to show you exactly how those sessions will fall over the next 6 months. And so moving on to the county specific sessions, thus far, we've confirmed that we're going to host those county specific sessions in Shasta, Trinity, Stanislaus, San Joaquin, Fresno, Kings, and Tulare. And those are going to be grouped into regions based on their proximity and similarity and infrastructure gaps. Just as we mentioned previously with that network assessment, we're trying to assess the gaps so that way we can make sure that we address that and embed it into the modules and the curriculum itself. And so within each one of those county groupings that we create with those counties, we're going to host 3 county specific sessions. So unlike the statewide sessions that are going to be more foundational and provide universal information that you might need additional guidance on, these are going to be very specific, therefore making them very advanced because they're including locally relevant information. And so as mentioned, that's going to be track 2 of our programmatic offerings. And to ensure that we have, an ideal learning environment, we are going to extend invitations to approximately 8 to 10 CBOs per region. And so that makes sure that the CBOs and the MCPs that are present and the other CalAIM landscape stakeholders have an opportunity to converse, have an opportunity to advance the dialogue, have an opportunity to ask questions that are needed in order to move the needle forward on, improving and advancing that contracting readiness. So now that we have an understanding of the difference between the statewide foundational sessions and the advanced county specific sessions, once again, the track 1 or the track 2, we also want to make sure that CBOs have an understanding of the core capabilities that they'll need in order to partner with MCPs. And so we have a few that are listed here that I'll briefly cover. And so the CBOs will need to understand, Medi-Cal managed care. This also includes understanding quality improvement and performance measures for the health plans. They'll need to know how to build, buy, or share capacity. This pertains to the CBO's infrastructure, and their contracting capacities. They'll also need to understand business case development, workforce requirements and skills. And most importantly, they'll need to understand the requirements for data sharing, the contracting lifecycle, negotiation best practices, claims adjudication and compliance. And so because we understand that there are multiple elements, multiple components that CBOs need support with. And going back to what I was saying previously, we understand that the CBOs have varying levels of contracting readiness. So we wanted to make sure that we provided a menu of topics that was going to cover all of these curriculum items, all of these curriculum touch points. And based off of this menu, you can see here that there are certain items that are going to be covered at a foundational universal level in the Track 1 statewide offerings, whereas in the Track 2 offerings, you can also see that those are also bulletized here. And we'll be going more in depth. So instead of us discussing the universal approach to being able to address those capabilities that the CBOs will need, we'll go into those in a much more advanced, in a much more specific, locally relevant manner. So that way we can have an offering that allows CBOs that may not be as advanced to have that introductory information in the statewide sessions, whereas the CBOs that are greater level of readiness, you might be already initiating contracts, you may have already been in communications or negotiations with the plans, and so you need more advanced information in that Track 2 offering. And so, as I referenced previously, we are kicking off the first statewide foundational session in the month of May, and that registration link can be found at the CalAIM website. Once again, that's going to be healthbegins.org/CalAIM. So that way you can register for that session. And we're also going to host the first series of sessions that are county specific in the counties that were previously outlined. Once again, you can find that information on the CalAIM Links website, so that way you can have access to all of those registration links. And the first series of sessions for all of those counties and the first statewide session will take place between the months of May and July. Starting in August, we'll go ahead and launch that second series of sessions, which will get kicked off with the second statewide session that will then lead into the second county-specific sessions for those groupings. And then by October, we expect to host our third statewide session, which will be followed by our third series in those county-specific sessions as well. Going back to the lessons that we learned from 2021, something that was so important that we took away is that there is a considerable CBO interest. As previously noted, we were able to continue this work because we received feedback from the CBOs directly, particularly those that serve historically marginalized communities that are at that earlier stage of contracting readiness, that there are more opportunities for them to learn about CalAIM, more opportunities for them to learn about plan contracting requirements and the performance requirements and pricing and rate information, and also in additional needs and training opportunities related to infrastructure. And so because of that, we wanted to make sure that we were taking those lessons learned, building them into the curriculum, and then partnering with plans to provide an offering that is not only beneficial, for the plans and being able to secure those additional contracts with CBOs, but also for the CBOs and being able to build up those relationships that are needed to continue and advance those contracts and to in turn support their communities. Going back to the CBO readiness assessment that I referenced earlier in this webinar, that readiness assessment is going to be available on the CalAIM Links website, and a hyperlink is going to be available within this presentation slide deck, so that way your organization can click it, take that assessment, and help us help you understand what your current level of contracting readiness is and which TA track would be best suited for your organization, whether that be the statewide foundational track or the county specific track that is more advanced. In either direction, you can definitely visit that website, so that way you can go ahead and take that assessment. It should only take about 15 minutes to complete, but it would provide us with a wealth of information that would then in turn be able to support your organization. Lastly, we know that there was an incredible amount of information that was revealed and disclosed in this presentation. So please don't hesitate to contact us at HealthBegins. You can definitely reach us at CalAIM@healthbegins.org. Once again, my name is Alexis Taylor. I am a senior program manager here at HealthBegins, and I'm the project manager for our CalAIM related work. And we're definitely looking forward to hearing from you. Going back to the goals that we outlined at the onset of this webinar, we want to make sure that we're moving the needle on contracting readiness. And we understand that CalAIM presents an amazing opportunity for us to better support Medi-Cal beneficiaries, which are some of the most, marginalized communities that we have in California. And we want to make sure that we are fostering equity and moving the needle on being able to provide them with the services that they need in order to live those full, healthy, and authentic lives. And so once again, if you have any additional questions, please don't hesitate to contact us. Visit the CalAIM Links website so that way you can go ahead and download this presentation and email us directly from the website as well. And I would like to briefly extend an incredible thank you to all of our project partners and to my project team at HealthBegins. And so the program officer for our CalAIM Links work is Carlina Hansen. She's with the California Healthcare Foundation, and she's provided an incredible amount of leadership on this work. And we definitely want to make sure that we acknowledge all of the expertise, all of the knowledge, all of the guidance that has gone into making this project a reality, so that way we can go ahead and help those Medi-Cal beneficiaries, via their providers and getting them those Medi-Cal contracts. I'd also like to thank my project team here at HealthBegins, which includes Dr. Rishi Manchanda, Nasser Amals, who is our Health Equity Program Analyst, and Sadna Devaraja, who is our Managing Director here at HealthBegins. If you would like to know anything else about our organization, you can also click the hyperlink that is included on this side to learn more about our direct website or our CalAIM Links website. I'd like to thank our amazing partners at Transform Health, which includes Gretchen Schroeder and Lisa Chan Sawin, who have been amazing partners in this work ever since 2021 in being able to help build out the curriculum and foster that relationship development between the plans and the CBOs as we, advance those contracting relationships. I would also like to extend a very special thank you to our partners at Aurrera Health, which includes Lucy Pagel, Jill Donnelly, Jessica Lieben, and Kathleen Kane. And then finally, I would like to send a thank you to our program evaluator, Beth Siegel at Mount Auburn Associates. Once again, thank you all for joining us for this webinar today. These materials can be located at healthbegins.org/CalAIM. And once again, please feel more than free to take that CBO readiness assessment and reach out to us if you have any questions whatsoever. Thank you all.